Hi there, folks. This is Dr. Ellenberg with our medical show here on Fox News Talk 1020 AM. Also find us on FM at 95.5 and online at foxnewskoan.com. That's foxnewskoan.com. If you have questions about your health or medical questions, this is a medical live call-in show, too. We can answer questions for you, hopefully. Our number here is 522-1020. It's 522-1020. Some reminders during the week. You'll find me at the Ellenberg Center for Natural Medicine. Our website address is drellenberg.com. That's DRELLENBURG, drellenberg.com. Check us out. List of our services. We have archive radio shows on our site. And we also have a list of a variety of links you can find online to learn more about things out in the world that affect your health. And also suggested reading materials as well for you to check out. My office phone number itself is 563-2366. And again, a reminder, I do see patients in Palmer and Kenai monthly, and give our office a call at 563-2366 for times and dates for those locations. All righty, well, let's go forward. We got a lot to talk about today. Talking about the flu today. Going to talk about berries for your health. Talk a lot about gastrointestinal disease today, GI health, that is, and also about asthma. Before we get started, I do want to remind everyone, if you're a regular listener, I apologize for repeating myself, but this is important. The Department of Commerce, Community, and Economic Development for the state of Alaska is proposing changes to the naturopathic scope of practice in the state of Alaska. I am a naturopathic doctor, an ND, and they're suggesting changes to our scope of practice that will limit us from doing a variety of things that we have been doing for a long time. We've been licensed in the state of Alaska since 1986 with no changes specifically to the way we are practicing naturopathic medicine in the state of Alaska. And now, for some reason, we have people suggesting we should have changes and restrictions upon our scope of practice, which we do not agree with. And I hope many of you do not as well. There is a site we have through the Alaska Association of Naturopathic Physicians entitled www.akn, as in Nancy, nat.com, aknat.com. Public comment for these changes is open this week until 4:30 p.m. on Thursday, the 24th of this week. So please, if you haven't made a comment yet, please do. You don't need to be a current patient of mine or anybody else's if you think this is a bad idea. Basically, the state is looking to limit your access to health care. And we encourage you to please visit our site at aknat.com and please post your comments. And there's even a section there to make your own comments of your own, or there's even some pre-written ones you can click on those. It literally takes minutes to make comments to the state of Alaska, and please, please do this for us. We'd really appreciate it. And that's www.aknat.com. Well, other note to know as well is that there's currently been a bill introduced in the Alaska legislative system through the House, also trying to limit the scope of practice for naturopathic doctors in the state of Alaska. I'll be working on getting some more information to you on that specifically, as where you can send your comments to. The bill was introduced in the House by Representative Kurt Olson. I do not agree with this bill one iota at all, and we'll let you know more as we go along. So we've got a two-pronged attack against naturopathic doctors here in the state of Alaska. Really unfortunate. There's currently about 47 licensed NDs here in the state of Alaska providing health care places in Fairbanks, Anchorage, and Palmer, and Wasilla, the Kenai Peninsula, and also the southeast part of Alaska as well, Panhandle, Juneau, and the Ketchikan areas. These changes suggest to our scope of practice either through the bill that's currently in the House in Juneau or through the Department of Commerce, Community and Economic Development will limit a lot of what we've already been doing for Alaskans for the last many years here in the state. So please make your comments where they're appropriate and also where they're needed to go. And for the one that's for the state directly, that again is www.aknat.com. Okay, we'll go on from here. So we're hearing a whole lot about the flu, right? 48 states, flu epidemics. We've got quite a few, of course, happening up here in the state of Alaska. Suggestions have been out there. Well, if you already get the flu shot once, should you go get it again? I don't know how many of you hear my show here very often here, but I'm a staunch person against the use of the flu vaccine. It uses the top viruses that caused the flu from last year, the top 3 that is, and that's made into a vaccine in the hope that this year's flus will somehow be diminished if you get the flu vaccine. The flu vaccine uses 3 viruses, the most popular ones from last year that are made in labs, And just so you do know, viruses tend to mutate and change frequently. So the same flu that happened last year isn't going to happen this year. Okay, this doesn't. And I've given much data over the last several years here in the radio station as well, directly demonstrating that the use of the flu vaccine is purely profit-driven, and your chances of getting the flu with or without the flu vaccine are exactly the same. I know some of you out there saying, well, I've gotten the flu shot for years, never gotten the flu. Well, guess what? I've not gotten the flu shot for years, and I haven't gotten the flu either. So that's up to you. And just so you do know, if you do get the flu vaccine, you're getting a nice little injection of what's called ethyl mercury in the form of a product called thimerosal. So nice little shot of mercury in your body. And by the way, you don't need mercury for health. It's actually against your health, and it's bad for you. So definitely a big fan of the flu shot. What can you do to avoid the flu? And if you get the flu, what can you do? So let's discuss some of those things. And again, this is Dr. Michael Ellenberg. If you have questions about our show today or questions about medicine in general, our number here, of course, is 522-1020, 522-1020. So keeping the flu away, some of my favorite things, and you know if you hear the show frequently or not, I talk a lot about vitamin D supplementation. The vitamin D RDA for adults is 400 international units. That's so you don't get rickets, the disease associated with a deficiency of vitamin D. For optimal health and for immune stimulation, which you actually can do with vitamin D, we're talking about much higher doses. And typically for an adult, some current suggestions have been at least take about 2,000 IUs a day, and that's coming from some corrections on the RDA levels. For children, typically about half that dose. And, of course, the best way to find out how much vitamin D you should be taking is to get a vitamin D blood test done and see where you're starting from. And most Alaskans are very deficient in vitamin D. Vitamin D is produced in your skin from the ultraviolet B radiation from the sun, and most of the year in Alaska that is being absorbed by the ozone layer due to our place on the earth, and therefore we don't make a whole lot of vitamin D in our skin. Vitamin D deficiency can also cause you to experience depression or anxiety, increase your risk of developing certain cancers based on various research I've reviewed here on the show over the last couple of years. It's also been tacked on for periodontal disease, for high blood pressure, and the reasons you might want to consider taking vitamin D. And, of course, in this case, we're talking about trying to avoid getting the flu. Beyond that, taking extra vitamin C during the winter is a very good idea. Natural forms of that are never a bad idea, but ascorbic acid can also work just as well, in my opinion. And vitamin C typically taken a couple of times throughout the day versus once a day can provide you with more benefit from it because our bodies don't store vitamin C, and therefore we need to actually consume it through our foods or through supplementation. Of course, high sources of vitamin C, of course, citrus fruits as being the main area, lime, lemons, grapefruits, etc. in that category. So ways also in boosting your natural levels of vitamin C. What else can we be doing? Well, there's a favorite herb of mine that I've talked before on the show several times called elderberry. Its Latin name is Sambucus nigra, and it's been around for a very long time, and it's been used as even a popular cold remedy called Sambucol. It's been on the health food market for a very long time and can be taken by children and adults. And what's so great about Sambucus nigra or elderberry is it's packed full of vitamins A and C, for example, and also a lot of flavonoids, which are found in a lot of different fruits and vegetables. And these have a hand at supporting our immune system and even can help fight when we are sick. And one of the biggest things I'm trying to get patients to do when they actually have a cold is do something to get rid of it sooner, rather than just taking symptomology approach by diminishing your nasal congestion or your cough. You're doing things to actually help out your immune system to boost it up so it can fight off this infection a lot faster. Vitamin D is a good example. Iodine can be used for that as well in the form of kelp. Elderberry, in this case, we're suggesting as well. Vitamin C are some great things to be considering to boost your immune system and to help fight off the flu or a cold when you do get one. So consider some of those very simple things to do. And, of course, hydration. Any of these things is always very important. Hydration does affect your immune system directly, so it's important to stay hydrated. And if you do have a cold or a flu, drinking plenty of water is never a bad idea to help boost your body's ability to get things out of your system faster and flush out these viruses that are making you sick. Okay, we'll go on from here. This is Dr. Michael Ellenberg. It's our medical show here on Fox News Talk 1020 AM, also on FM at 95.5, and online at foxnewskoan.com. If you have questions about your health today or questions about our topics on here on our show, give me a call at 522-1020. It's 522-1020. All righty. Well, let's hop down. And where do I get this guy here to talk about today? I want to talk about asthma here for a bit. And, it's interesting looking at and reading different research that's out there and so forth. The show, if many of you don't know this, if you don't listen often, typically try and find things out in the research that have a lot to do more with chronic disease conditions such as asthma, inflammatory bowel diseases like Crohn, ulcerative colitis. Cancer is a big topic here, of course, on the show frequently. High blood pressure, diabetes. These are big groups that affect a lot of people, and certainly asthma is an area that affects quite a few people. And there's an article that appeared in the Journal of Thorax just recently discussing how we have a kind of a link, and this is not surprising. So fast food linked to childhood asthma and eczema. Eczema being some type of dermatitis that causes basically a skin irritation and redness and itching. And a lot of people with asthma can suffer from this as well. And you can even see actually psoriasis, which is not eczema. It's a different type of skin condition also found in people who have asthma. But in the study, they noted that eating fast food 3 times a week increased asthma severity and eczema in children. And this study was done in the United Kingdom and looked at more than 500,000 children. And the database actually is a huge one that actually encompassed about 50 countries, looking at diet and looking at the increase in allergy-related conditions associated with asthma. And it's not surprising to hear this. Those who ate fast food, such as burgers, risk increasing asthma symptoms, itchy, watery eyes, and even increased eczema as well. What proved to be protective, of course, with foods is always good to know. And the journal reported that eating, of course, plenty of fruits appears to be very protective, and I would certainly suggest even eating plenty of vegetables will be very protective as well. And what is it about, fast food is bad for you? Well, there's so many things, but in this particular article, they're talking about the high levels of saturated and trans fatty acids, which are known to affect the immune system. And why would fruit be helpful? Because you have lots of good antioxidants and other flavonoids or healthy plant proteins that are found, in this case antioxidants, found in vegetables and fruits. And in this particular study, they looked at that children in their early teens who ate 3 or more weekly servings of fast food had a 40% increased risk of severe asthma. And 6 and 7-year-olds had a 30% increased risk of asthma. And eating 3 or more portions a week of fruit, this 3 or more portions in a whole week, not per day, cut the risk of severe asthma and eczema, watery eyes, sneezing down by almost 11 to 15%. Now, one part of this article that I don't agree with is this statement here. It says, generally, people with asthma do not have to follow a special diet. Well, they're not told to. Let's put it that way. And there are certainly, in a lot of asthmatics, foods that are triggers not only for their asthma, but also further allergies in their body in the first place, such as cow's milk, dairy products in general, eggs, certain fish, yeast products, and a lot of different food colorings and food additives that are put in food that are totally artificial that can also trigger allergic symptoms in patients. And definitely one that I think is worth noting out of this whole group is kind of a personal story, and that's cow's milk. So I was a huge milk drinker up until the age of about 22, and definitely had asthma frequently. I typically would get some type of a cold each year with some type of bronchitis might get involved, and I had definitely continued to use some type of inhaler so I could actually exercise without getting asthma. And when I quit drinking milk, I was able to stop using an inhaler for exercise. I could exercise without taking any asthma medication, which today I still can do. And this has now been almost 20 years of being off of cow's milk. And only of recent have I really gotten off of all dairy, including cheese. I had been on yogurt for a long time, but I still, here and there, was eating cheese. So that improved, and luckily I'm not on some wood here. I haven't had bronchitis or pneumonia since age 19, and I'm now 42, come up here in May. So it can be quite a benefit. So I would suggest that actually a special diet could be helpful for those who have asthma. Not everybody who has asthma is going to have trouble with cow's milk or dairy products, for example, or eggs or fish or even certain nuts. But some of us certainly are. And one of the hardest parts is that you can have, if you have asthma, if you had it a long time, or if you had it really bad, many of us have been through the process of allergy food testing. I remember going in when I was about 10 to the allergist here in Anchorage at the time, and they had these 60 numbers written all over my whole back of my arms, and they were injecting me with very tiny amounts of a variety of allergens per spot, and to see what kind of reaction I had to that. That type of testing is called an immediate hypersensitivity reaction, so it's going to happen immediately. Now, the biggest problem these days is that most tests are unable to accurately test for a delayed reaction. Meaning, you say you drink that cow's milk, it's not a problem today, but it kind of affects your immune system a bit. Maybe next day you have a little bit of sinus problems, or you feel kind of groggy. I mean, you could even have loose stools or have abdominal pain. I mean, it could be a variety of things, even unrelated to your gastrointestinal tract. And that is a delayed hypersensitivity reaction. So it's a delayed response to an allergen. And as I mentioned, most of the tests out there for the delayed reactions can be highly inaccurate or give false information or say you're totally fine when you're not. And still, one of the best ways to consider figuring out your food allergies is what's called an allergy elimination diet. And anybody out there who has asthma that's of any severity of any kind, or you even have asthma that's even mild, you should consider looking at an allergy elimination diet and see if you can figure out what foods might be triggers and have them rotated in and out of your diet, or move them completely if that's convenient for you or not, and then see how your asthma does. Because certainly for me, taking out cow's milk and made a huge, huge difference in my asthma symptoms, severity, and occurrence of different types of lung infections as the years went on. So it can be highly helpful. So again, it's a reminder, yes, your diet can definitely contribute to your asthma. And even what they don't talk about in this article, which is worth pointing out, is that if you're eating really lousy foods, that's actually going to also affect the environment in your gastrointestinal tract, affect the bacteria or the production of healthy bacteria. And we now know that the bacteria in your GI tract have a huge play in how your immune system develops and how it acts for your whole life. And certainly taking probiotics to help strengthen your immune system directly through your gastrointestinal tract might actually make a difference if you have asthma. So please consider that option as well. Take healthy bacteria, foods that are high in probiotics naturally with things like sauerkraut, kefir, which is dairy, but some of us can actually consume that, not me. We also have water kefir, which is fermented water. And you also have things like yogurts and other fermented foods that exist out there that can be quite helpful to your gastrointestinal tract and give you some nice healthy bacteria. Things like kombucha, which is a fungus that can be made as well at home in batches and has lots of good probiotic or healthy bacteria inside that for your gastrointestinal tract. So please consider that. And remember that with asthma, the food allergy piece is really big, and it's certainly worth considering in the long run about where things are at. And if you have those sort of things, as far as certain allergies making your asthma worse. Okay, let's talk. We got about 6 minutes here before the bottom of the hour break, and there was an article that appeared. When does it appear at? Actually, is from the National Research Council and the Institute of Medicine. And it's not a great title. The title is Americans Have Worse Health Than People in Other High-Income Countries. And the start of this article comments on it that on average, Americans die sooner and experience higher rates of disease and injury than people in other high-income countries. Well, what are some of these countries? Places like Australia, Canada, Japan, and many of the Western European countries. And in this particular article, they compared us with 16 peer nations, as they say, to compare us to places that have similar incomes and ethnicity groups, and etc., as far as looking at rates of disease. And the report finds that this health disadvantage exists at all ages from about birth up to about age 75 here in the U.S., and that once you're past 75, we actually are seeing some greater benefits here in the case concerning those over age 75 if you make it to age 75. And that this is even talking about in groups who have health insurance, those who have college education, those who have higher incomes or have healthy behaviors, and still appear to be sicker than other nations that we were compared to in the study. And it's unfortunate. Well, why is this? Well, a lot of they don't go into the exact reasons in this particular article, but some of the big areas that of interest here in comparison to other countries is one is infant mortality and low birth weight. That means infants who don't make it very long and die as an infant. That's called mortality. Other areas that were relevant in this case for our discussion is obesity and diabetes, heart disease, disabilities, chronic lung disease, the main stuff. And so most of these things we're talking, except for the infant mortality rates, we're talking about things that are chronic. And it's still amazing to me that we have a higher infant mortality rate than, say, many other countries compared to us. I'm not sure why that exactly is. It could be a sign of just typically how, unhealthy a lot of us are in general, and that when having children, the children, I mean, I try and space a lot of moms, and the moms that will get this one, but, your children, you were the vessel they grew in. And if your health wasn't that great when you were pregnant with that child, then it's a good chance that that child's health is going to be impacted from that going forward. And they take your iodine from you, they take the vitamin D from your body, they're going to take any essential fatty acids you have to help them grow their brains, for example, and affect their immune system, and all these things that are important, like iodine help for good growth of thyroid glands when they're growing inside of you. All these things that are important for making a very healthy child. And certainly, our infant mortality rate is still at a range that is quite surprising for this country when it should be much less. I said the good news of anything in this particular article is that those over age 75 here in the U.S. tend to be having lower death rates from stroke and cancer, and better control of blood pressure and cholesterol levels, and lower rates of smoking. So we have some good areas, but it's really unfortunate. I think a lot of these things that particularly impact the health are more the chronic conditions, as I mentioned: obesity, diabetes, heart disease, and chronic lung disease. And this is one area in medicine where we tend to do not have the best results because we're using kind of this picture of, well, instead of being an acute problem, something you've had for a very short time, and here's a drug for this to help you out, it's take this and the rest of your life, and you're on this for good. Where with things like obesity and things like diabetes, you can change all of those by exercise and diet. It's been proven over and over and over again. It can be done. It really can be. And we certainly in this country don't have a whole lot of emphasis by our providers in general for us to get in shape and take care of ourselves. In fact, the biggest thing to talk about too is when you see a provider is look at your doctor. Are they healthy? And that's really important, because if your doctor's sitting there in front of you and telling you to go on a diet or try exercising and they don't look like they do any of those things, it's a little bit hard to take their advice, okay? And it's important to walk the walk, all right? I've lost, I'm 165. I've lost over 15 pounds in the last 2 years, which I just didn't have on me. I exercise strictly during the week. I take care of myself. I get good rest. I try to eat a good diet. Trying to follow the things I want my patients to do. And that's the thing that you want to be doing. If your doctor's not telling you to do those things, then do it on your own. But the reality is a lot of the chronic things that we're suffering from, there's not a drug for them to cure you. You're the cure. You make the changes. And then you will get better from most of these things I'm talking about. Obviously, if it's things concerning cancer, that's a different story. But with these chronic conditions such as cardiovascular disease, diabetes, and obesity are things that we can make all the changes on our own that can change all these things. So it's unfortunate. This article, again, is from the report from National Research Council Institute of Medicine, demonstrating that, unfortunately, compared to 16 other countries, we're pretty much on the bottom of the 16 for having really healthy Americans. So we have some big changes to be making. And it's important because the less healthy we are, the more we're going to cost our system in the end. People who are on Medicaid, for example, people once they're above 62 or have Medicare, it's going to be harder on the system long term if we're not a healthy population. It really makes a huge difference in where we go from here, and it ends up being translated into money, actually, in the end as well. All right, we got about, 30 seconds here to the bottom of the break here. Again, some reminders, if you feel like making comments to the state regarding the changes to the naturopathic medical scope of practice here in the state of Alaska, I'd really appreciate it. Please check out www.aknat.com to make comments. That's www.aknat.com to make comments to the state by this Thursday. All right, see you back in a few minutes here.
And you're not moving anywhere. You thought you found a friend to take you out of this place. Someone you could lend a hand in return for grace. It's a beautiful day. Sky falls. Look at all the lonely people. Look at all.
Hi there, folks. This is Dr. Ellenberg. We're looking at the second part of our medical show here on Fox News Talk 1020 AM. Also on FM 95.5, and you can find us online, of course, at foxnewskon.com. Foxnewskon.com. Live stream us online. All right, well, think to turn in the second part of today's show. We're going to talk a little bit about cancer for a little bit. There was a very good article that appeared in the Journal of Cancer entitled Antioxidant Supplementation After Breast Cancer Diagnosis and Mortality in Life. Actually, it appeared in the Journal of Cancer Epidemiology, And this particular study examined the association between women who had breast cancer and they had gone into remission, so after diagnosis, and looked at outcomes in 2,200 women, and looking at the type of antioxidant supplementation they had been taking since diagnosis and even afterwards, and other factors were looked at as well. And what they were looking at in the study specifically was, had there been any breast cancer recurrence, and any mortality from any breast cancer that may have occurred. And the antioxidant supplementation use after diagnosis by women with breast cancer was about 81% in this study. And among those people using antioxidants such as vitamin C and vitamin E, for example, was associated with a decreased risk of recurrence of breast cancer by almost 30%. So quite a number. So third, people had less recurrence of breast cancer who were taking vitamin C and or vitamin E. And in those who were using only vitamin E, they had decreased risk from all-cause mortality. It means any cause of death, even beyond cancer, was about 24% decrease. So some very great benefits. And, one of the biggest things you chronically hear, in fact, this new article out here just very recently talking about, is the use of antioxidants during chemotherapy. In the sense, so patients say, well, I've got breast cancer. I'm going to be getting treatment every 3 weeks for 6 cycles. So that means 6 treatments. So over an 18-week period of time, they're going to get 6 treatments. And a doctor will typically tell them, please don't take any antioxidants such as vitamin C, vitamin E, just to name a few. And the reality is, what if somebody was a vegetarian, for example, and they're eating plenty of vegetables and fruits the way you should be doing if you're a total vegan? They're getting loads of antioxidants while they're doing that. And yet I don't tend to hear back from patients when they see their oncologist and they come to see me for what else they can be doing besides chemoradiation and surgery for their cancer. And I don't have them telling me, hey, my doctor said I shouldn't eat any fruits and vegetables. Now, that might seem kind of a simple way of putting it, but it's really the case. It's like, just tell you to stop eating because you're going to get antioxidants from a lot of your foods you actually consume in the first place. There have been a lot of studies actually done looking at the use of antioxidants in patients who are receiving current radiation or chemotherapy. And I think in particular one, it might have been vitamin E with radiation that may have had a decreased effect for the most part. However, we're having people live longer. People have better results when doing chemotherapy or radiation, and less side effects from therapy in those taking antioxidants during their actual timeline of getting their cancer treatments. So the data's out there. You just don't hear much about it. You always hear the negative ones that get reported while you're doing it because no one wants to hear that vitamins actually do anything that's good for you in the first place, right? You can't patent them. Most of them you can't patent, that is. So there's no money to be made off a lot of these things. But it's, again, a reminder, once again, of the benefit of antioxidants in people who do have cancer or are in remission and want to stay that way. And that's where we want to keep you folks out there. If you get in remission, we want to keep you from ever getting cancer ever again. And I remind patients of that frequently, that once they do get there, is that it's, the whole process of getting cancer, and it's a process. It's not just the fact that it happened. Things make it happen. Stress makes it happen. Diet can make it happen. Other disease conditions can make it happen, like diabetes can increase your risk of getting cancer. So it can be obese. So being obese increase your risk of getting cancer. We need to make changes, complete changes. Sometimes almost 180s in our health, because you want to create a body where cancer is not going to want to grow in you again, okay? And not uncontrolled, at least, because we certainly do have many occurrences frequently in all of our lifetimes where cancer exists and your body just takes care of it like it's supposed to do. So when that process breaks down and it can't handle that cancerous process and it turns into tumors or a tumor, that's where we're full-blown, now we have cancer. And if that does happen, we want to change the process of how that happened. And we as patients need to be doing that approach, because a lot of us aren't being told to do that. We're being told, hey, listen, we're going to take care of your cancer. You don't worry about a thing. Go on with your life. Don't change anything. Don't worry about it. No. You need to make changes. You need to change your diet. You need to eat almost no sugar, because sugar feeds tumors. Tumors eat glucose, sugar. That's their main fuel source. So, it's important to realize a lot of these things and try and look at what is the best way we can use all therapies that are currently available and all regimens that are available to help treat cancer, and not just looking only at chemotherapy, radiation, and surgery. What else can we be doing to add to that process? A recent article appeared here in the last week, too, talking about there's a 20% reduction in overall cancer mortality rates in the U.S. I don't know how they're actually getting that figure, to be honest with you. I have a hard time believing it. I'd like to believe it, but I just know the data that I read says just the opposite of that. Cancer rates are up and more people are dying from it. Our ability to actually track this data when somebody dies from cancer is difficult because it relies upon the medical provider who signs the death certificate of that particular patient, did they die from cancer? Usually you die from something else. The cancer may have caused it, and a lot of times it's put down as the main thing. They died from the following: anemia, or they died from heart failure, died from lung failure, or kidney failure. And it may have been exactly to do with the cancer itself causing those things to happen in the first place. So it's difficult in collecting that data. So please be diligent and continue to do all that we can, do all of us, to prevent ourselves from getting cancer. And if you do get cancer, please remember you need to make some serious changes to your life to really fully combat it and get rid of it and never see it ever again. That's the key. Okay, folks, it's Dr. Michael Ellenberg. It's a medical show here on Fox News Talk 1020 AM, FM 95.5, and online at foxnewsKOAN.com. You can live stream us. If you have questions about your health, questions about our show, please give us a call, 522-1020. I want to make this comment one more time. The Department of Commerce, Community and Economic Development are proposing changes to the naturopathic medical scope of practice here in the state of Alaska. And they're not good changes. They're actually restricting certain things that naturopathic doctors have been doing in the state since 1986. These changes, in the end, if they were implemented, will ultimately limit your access to health care here in the state of Alaska. And we'd like all of you out there to make a comment against this proposed changes to our regulations for naturopathic doctors here in the state of Alaska by visiting our site at aknat.com. That's AK like Alaska, AKN as in Nancy, at.com. And make comments, and they're directly submitted to the Alaska Division of Corporation, Business and Professional Licensing. You can do it by email, which is very simple, and that can be done through our site at aknat.com. That's Alaska Physicians Association of naturopathic doctors here in the state of Alaska. So please do that before Thursday. Make your comments and tell them the main thing is just don't change anything. We're doing a good job taking care of patients here in the state of Alaska. We're going to continue to be able to do that, and it's important that these changes are not implemented. Okay, well, we'll go forward from here. So thanks for letting me tell you that, folks. Again, questions, comments about any of this as well, give me a call here, 522-1020, 522-1020. Okay, let's talk about gastrointestinal health, because some very interesting studies came out in this last week that highlight really the importance of these bacteria, these hundreds of trillions of bacteria that live inside of us, and how they can actually affect our health. And in an online published journal here of pediatrics for this month, babies who develop colic were looked at. And so colic tends to be these babies who are fussy and crying, might have gastro or cramping pain, even some alternating types of bowel movements, and they typically tend to grow out of it, but they can develop for a certain period of time. And using certain technology, and a study came out of the Netherlands, they looked at the development of the microbiota, kind of the microscopic life environment of these trillions of bacteria in our GI tracts, and looked at it from birth to approximately 100 days, and it's in a small group, but in 24 infants, because it's difficult. And looking at the development of intestinal bacteria inside infants, parents of the children basically had to collect bowel movements from the children and bring them in, and have the microbiologists, try and grow things from it and see what kind of bacteria inside these infants. And what's interesting in this particular study is that at 2 weeks, babies who were later diagnosed with colic had a much less diverse bacterial environment than their healthy counterparts they were compared to. And there were certain types of bacteria that were showing up that don't tend to be very healthy in higher numbers for children versus these infants and those who didn't have that. And you have kind of a peak that takes place. And so this peak is, the difference between the colic and the babies with healthy bacteria in the GI tract is in the first month of life, is that before the colic peak, as they put it, takes place, when the colic for a child gets really, really bad, is that this difference in these children disappears at around 3 or 4 months of age, and usually resolves. Most babies with colic, it resolves after a period of time and they're fine, but in the interim they can be going through a very bad time for themselves and for the parents, that the baby can't sleep and has frequent problems. And a lot of us can even have to do sometimes with allergies if the baby's being fed some type of formula and not being breastfed, for example. And a lot of children who were born via C-section, they're not really being exposed to a lot of bacteria from mom. And then furthermore, if the children are not breastfed, They're furthermore not getting bacteria from mom because a lot of bacteria in breast milk is helping seed that gastrointestinal tract of the infant. That's why being vaginally born is a bonus and being breastfed is another bonus. And typically in these kind of children, we tend to see a lot less allergies and asthma and food allergies as these children get older because they've got a lot of good healthy bacteria from mom taking place. Because when a child's born, the GI tract is virtually sterile. Not a whole lot of bacteria in there at this point in time. And it rapidly colonizes bacteria in these first few months of early life. And it's interesting to see that, we definitely have a much more better handle and description as to why infants versus some other infants are going to have colic and those are not. And certainly this gut flora is a huge piece, and babies can actually be given probiotics safely when you use certain forms. And, of course, talking to your pediatrician or those who treat infants who use probiotics are good to talk with as well. Looking for a good bacteria to support a GI tract in an infant. And furthermore, in infants that end up being put on antibiotics early in life due to some type of infection, that also is another hamper on their gastrointestinal tract because antibiotics, which kill bacteria only, but they're not selective in a sense, will also kill all bacteria. Well, will kill even the good bacteria and the bad bacteria that may be causing an infection for them. So it's important to realize that in children that are given antibiotics frequently as in youth or as infants, that giving those children a good source of probiotics orally can help reseed and strengthen their gastrointestinal tracts and have any long-term effects from taking antibiotics multiple times over. A lot of times in children who we see antibiotic use as an infant or even in their early adolescence tend to be children that may develop allergies as they get older. So very important to consider that as well. So if you have a colicky infant, you might want to consider looking at the use of probiotics to move things along faster and get that GI tract in a better state of health for them. So that was the first one on GI tract health. The other one is going to sound kind of crazy, but it's the first kind of a peer-reviewed article that's been in a major journal looking at something called fecal transfer. So basically in this case, it's a medical treatment where a patient is given literally poop from a donor person, somebody else, who has healthy bacteria and has no GI tract problems to help treat a gastrointestinal tract to get rid of something. Now, here's a study that was done. Again, it's quite odd, but it's nice to see it in a mainstream journal. So it appeared in the New England Journal of Medicine, which is a very prominent journal here in the U.S., and it was looking at the treatment of a diarrheal infection called Clostridium difficile, or C. diff for short, which can happen frequently after someone's been in the hospital. And can even after someone's taken antibiotics to treat another infection in their body, and can lead to a diarrheal infection where Clostridium can grow up inside them and cause all kinds of terrible bowel movements and gastrointestinal pain and be really hard to treat. And this study was done in the Netherlands, but reported in New England Journal of Medicine, and looked at 3 different treatments. Now, in all these treatments, every one of the patients in the treatment wing, so to speak, received antibiotics. All received basically the same antibiotic called vancomycin, which is a very, very strong antibiotic. And in the group that received the antibiotic and was followed by a bowel lavage, where they basically inserted fecal from a donor person, a healthy donor person, into that patient's gastrointestinal tract. That's how it was done. And what's quite wild is there was a substantial improvement in comparison to those just doing antibiotics. And almost 81% of the patients had a success rate of getting rid of their C. difficile after they were given the bowel transfer and along with antibiotics. But the antibiotics were much less on their own. Only about 20% of the patients actually got benefit from the antibiotics. When they added in the fecal transfer, it made a huge difference. And this has been done, I think, early on, not many years ago, with a lot of babies and children who have really bad gastrointestinal health, where they actually will do a fecal transfer from mom. It's called a fecal transplant, and take some of mom's poop, and it goes into the baby, in the sense of the young child, to help reseed their gastrointestinal tract with healthy bacteria. Now, most of us don't know this, but your poop, half of it is bacteria, not food. Half of it is bacteria. And this is the first controlled trial of this type of procedure. There's been many case studies that have been looked at, and there's these case studies in the past that have been done, It's about 90% effective. So it's highly, highly effective. And we're hoping that we're going to see more of these studies come out demonstrating that it seems kind of crazy in the sense of transferring someone's fecal to somebody else, in this case to help treat them for a disease. You're transferring, in a sense, healthy bacteria from healthy donors into somebody who's sick, suffering from a gastrointestinal type disease. And we might even begin to see this in populations of people such as inflammatory bowel disease, which includes ulcerative colitis or Crohn's, irritable bowel syndrome, and there's even some speculation that it may provide to be a treatment for obesity, because now we're finding out that the type of bacteria in your gastrointestinal tract may increase your risk of developing obesity or even diabetes. So we have a long ways to go in this particular studies, but it's very, very interesting. I know it sounds quite odd as far as the treatment, but this is a mainstream treatment that was done in a mainstream center, not some alternative center for that matter. So very interesting that we can begin to look at this direction. Again, a reminder of the power of bacteria, healthy bacteria, and how they can be used to treat a variety of disease conditions inside our gastrointestinal tract and maybe in other parts of our body as well. Okay, folks, we've got about 7 minutes left in today's show. If you've got questions or comments about today's show or about medicine in general, now's a good time to call, 522-1020, 522-1020. And we'll wait for that. If anybody's going to call here, we'll go on a few more nice little topics here today we didn't get to after we've gone through the show today. Berries. We talk a lot about antioxidants, and we talk a lot about where do you get good, healthy, antioxidants from. And a big area that's a lot of us sometimes don't think about is things like blueberries, things like strawberries, blackberries, for example. These really dark-skinned fruits. And in these dark-skinned fruits, you have a big category called flavonoids, and within this category is some called anthocyanins. But it's recognized flavonoids as being a very, very healthy part, and also lots of antioxidants in blueberries, blackberries, strawberries, to name a few, that have great anti-inflammatory effects. And the Nurses' Health study here was done several years ago, and there was so much data collected from this study. So over 93,000 women participated in a Nurses' Health study, number 2. And from that, we've noticed that those who consumed a high amount of a diet rich in things like blueberries and blackberries had almost a 30% reduction in the risk of developing a heart attack. And in this huge cohort group of almost 93,000 women who were followed for up 18 years. So very, very helpful. Let's pause that caller on line 1. John, are you there?
Yes, I am.
Hello there.
Yes, doctor. Hello.
I'm here. What can I do for you?
You were just making some comments about C. difficile.
Yes, sir.
And a couple of years ago, probably 3 or 4 years ago, I had a doctor here in town do a stool culture, and she told me that that's what I had, and we had to order, I guess, a high-power antibiotic by the name of Alinea.
Okay.
Okay, and something was a special order. They had to special order it, not something they carried at Fred Meyer. So I was wondering, evidently the follow-up culture after that was, she said I was free and clear. Would you recommend doing something again a few years down the line?
It wouldn't be a bad idea. I mean, the thing is, when you have a stool culture done and they're trying to measure bacteria of any kind from the gastrointestinal tract, it's going to really matter on how many of those bacteria are present on that particular day of testing. And you could still have C. diff in you, but in very tiny amounts, it's not going to do anything. But definitely down the road, as long as you're not having any current problems with your bowel movements or having diarrhea or frequent diarrhea, which I assume you're not, correct?
No, I was not at the time either.
Okay.
It was just something she had. They were doing lots of different testing at the time, and she kind of put that one in there as a. I'm not sure why, but then it came back that I was positive, and
then you got treated.
And then we treated it with the Alinea. And there you go. The end result was she said I was free and clear and good to go. I was just wondering if I should have done some kind of a follow-up just down the road to make sure there was...
Well, I think down the road is a good idea. And beyond that, besides the actual follow-up in that piece, is you should consider taking probiotics yourself, to maintain a healthy gastrointestinal tract. Put in some healthy bacteria to help boost that immune environment in that GI tract would be a great idea. It's kind of like insurance.
Yeah, and I do that from time to time. Should I do that daily? probiotics?
I get that question quite a bit, and as long as people aren't having a lot of problems, I typically tell them, pick kind of like you suggested. You pick a timeline, say for 3 months, I'm gonna take them every day, and then take a break for a while, and then go do them again. Kind of just here and every so often taking, and foods in general that are high in probiotics, things like sauerkraut. There's kefir, which can be made from dairy and even water. Yogurt has a small amount of probiotics in it, but
Right.
those sort of things are a good idea. And it sounds like the way you're doing it with taking the probiotics every so often, that's a good idea. Daily, if you're not having any problems, I don't think you have to take it daily.
Okay.
Okay.
All right, doctor.
Well, great. Thanks for the call.
Thanks for your help.
No problem. Yeah, and what's interesting about C. difficile is that it tends to be these days one of the more common causes of diarrheal infections after someone's gotten out of the hospital. So it's quite prevalent, unfortunately, in a variety of places in hospitals. I'm not going to name one here in Alaska, but I'm just saying in general, that's where we see a lot of, nationwide, we see a lot more Clostridium difficile or C. diff infections after someone's been hospitalized, and not necessarily for some type of a gastrointestinal problem. So very interesting. So thanks for the call there, John. But as I mentioned before in talking about, what are the benefits of eating things like blueberries, for example, eating things like, strawberries, eating things like blackberries and other currants, for example, is that there's really high concentration of what's called flavonoids. Great for your blood vessels, probably why we see this major reduction in this women's health study, nurses' health study, in the occurrences of heart attacks. That's one big piece we're probably looking at in here. The biggest thing I want to point out about in consuming these certain types of berries is it's important to really buy them organically or harvest them organically. Blueberries are number 1 on the list, actually number 3 on the list for the most heavily laden pesticide exposure of any fruit or vegetable. Strawberries are like number 6 on the list. Blackberries, not sure where they fall exactly on the list, but blueberries and strawberries are very common. You can buy them in the store, and you can get them lots of places, bulk packaging. But if they're not organic, you really want to consider if you're going to use them for your health to get organic sources. I know they cost more. You get a lot less. Believe me, I use a protein shake that I drink off and on a few times a week for several years, and I was buying the bulk package from the big package store, and it was a great deal. $12 for a giant bag of blueberries, but the blueberries were not organic. They got pesticides on them. And you're trying to eat something for health, get them organically. You're going to pay more, but in the end, you're going to have less of these things in you, which is really important because all of us have pesticides in us. All of us do. It's to what level is the answer, is the question. So remember, for your heart health and cardiovascular health, consider berry-rich diet such as blueberries, strawberries, blackberries, and the like. Again, organic, very key. Okay, so we got to that piece. We got about 1.5 minutes left today. One more reminder. So I'll not talk to you about this again in a while, and that is Department of Commerce and the Community Development want to limit the scope of practice for NDs in the state of Alaska. Please comment on our site at www.aknat.com. That's www.aknat.com. Let them know, please don't change anything. We've been serving Alaskans for over almost 30 years, and we want that to stay the same way it's been that time. So thank you very much for listening today, folks. We'll talk to you next Monday. Take care.
All new directions must go everywhere. Big round people in a cool little square. Or you can't cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family.